Hi, I'm Monica Salerno, and today we're going to review fixed implant prosthesis maintenance using the American Eagle Implant Kit. Fixed implant prosthesis maintenance is not a one-size-fits-all. Access changes, and choosing the right scaler makes all the difference. Here's a quick, practical guide to implant instrumentation using medical-grade titanium implant scalers from the American Eagle Implant Kit. In the next 3 minutes, I'll show you how to use the top two implant scalers for fixed implant prostheses, both when the prosthesis is in place and when it's removed. Patients with fixed implant prostheses typically remain on a 6-month maintenance schedule. At every other visit, the restoration may be removed. That means scaling with the restoration in place usually happens about once a year. Instrumentation should adjust based on access. Before instrumentation, it's crucial to assess the patient and look for signs of inflammation, bleeding, and calculus buildup. This assessment helps guide the flow of the hygiene appointment and informs which instruments may be most appropriate. For fixed implant prostheses, the Langer 3-4 and Nebraska 128 Langer 5 combo instrument are great options from the American Eagle Implant Kit. The Langer 3-4 is a multi-angled posterior universal implant curette. Its design is great to gain access in full fixed implant cases. This instrument is useful when the prosthesis is in place. It has the length to reach the implants and then work your way along the arch using light pressure and short horizontal strokes. The long shank allows access to clean along the edge of the restoration and safely disrupt biofilm and any visible calculus around the implants. Remember to use short horizontal strokes with light pressure. Next, we have the Nebraska 128 with a Langer 5. This instrument is a combo instrument that is ideal for use when the prosthesis is removed. The Nebraska 128 end can be used around fixed titanium bars, like you see here. Insert the end straight underneath the bar and work your way around the arch. You can do this on the upper and lower full fixed cases. Use short horizontal strokes. The Langer 5 end fits inside small spaces such as screw openings and locators. Use short horizontal strokes and even circular strokes to clean these areas. Here I will show you how you can use the working end of the Langer 5 to clean the locators out around the screw head and around the base of the locators. This working end helps to clean tight areas and exposed threads also. Hopefully you won't see exposed threads too often, but if you do, you can use this end to clean the threads with controlled short horizontal strokes. Additionally, the American Eagle Implant Kit has posterior implant scalers and curettes that you can use depending on anatomy and availability. This American Eagle kit has the 204S and the Barnhart 5.6 available to you to use for multiple different implant cases. All American Eagle implant scalers are manufactured from medical-grade titanium designed to clean effectively without damaging the implant surfaces. And the Eagle Light resin handles offer a unique ergonomic design that helps reduce hand fatigue during instrumentation. Implant instruments can be sharpened with a diamond stone. Make sure to have a separate stone for sharpening medical-grade titanium only. Implant maintenance is about assessment, access, and choosing the right instrument. When used correctly, titanium implant scalers can help support long-term implant health. Thanks for watching.